Welcome back to Beyond the Chart, the podcast that takes you past the paperwork and goes straight into the heart of healthcare. We're so glad you're joining us today for another great conversation. I'm Candace, joined by my co-host Teresa, and today we have a very special guest with us.
If you're a parent in the high desert, chances are you already know him. And if you don't, you're about to find out why so many families love him.
He's our favorite pediatrician, a Disney enthusiast, a devoted Golden State Warriors fan, a Bruno Mars superfan, and most importantly, a physician who is passionate about helping children grow up healthy and happy. He was also voted best pediatrician in the high desert 2 years in a row, a testament to the care, compassion, and dedication he brings to his patients every day.
Today we'll be talking about some of the most common questions parents ask, including one topic that's on just about every family's mind.
Screen time. How much is too much? What should parents be watching for? And how can we help our kids build healthy habits in today's digital world? So we are excited to dive into all of that and more. So please join us in giving a warm welcome to Dr. Marcus Barber. Woo! Welcome, welcome. All right, Dr. Barber, we're going to get started. You ready?
I'm ready.
Okay. So before we get into our serious conversation, we will have to ask you, if Disney, the Warriors, and Bruno Mars were all competing for your attention on the same day, who's going to win?
If Steph Curry's playing the Warriors.
Really? Okay. I would not have guessed that. Big Seth Curry fan. I know you are. Yeah, that's awesome.
All right, Dr. Barber, how long have you been a pediatrician?
Over 30 years.
Did you always know that you wanted to go into pediatrician?
Childhood. I even have a little book I still have of, when you're little and the colorings and it has in it. What do you want to be when you grow up? Pediatrician.
We need to frame those.
I know. We should frame those in your...
Should bring them in.
That's a good idea. Mm-hmm. So like when the teacher was asking what you want to be when you grow up, it was always pediatrician?
Yes.
That's pretty cool. I like to hear that. So this is actually a question that I was recently asked and thought it'd be a great one to bring up. So many parents aren't sure what the difference is between a pediatrician and like a family medicine doctor. So can you explain the difference between the two and then why parents should choose one or the other for their child?
So we're not knocking family practice.
Family
practice usually get trained in pediatrics, internal medicine, and gynecology versus pediatrics. You're just straight peds and going through it. You go through residency and you go through everything, pulmonology and dermatology, et cetera. So now you're out practicing. Like if you're in a rural area, family practice is great. But if you're usually in a bigger city, you have more options. And coming from pediatric training, I would tell somebody if you had to pick, pediatrics would be the route to go because that pediatrician is seeing nothing but kids every single day versus family is seeing a variety. And over years, you build up, you learn,
what to be looking for.
So it's
more specialized in kids.
Specialized.
That makes a lot of sense.
So should kids start seeing a pediatrician since they're born?
Oh, you start at birth, they get seen in the hospital, then the 1 week visit, 2 week visit, 1 month, 2 months, 4 months.
And until what age do you think is an appropriate age for the children to keep seeing a pediatrician?
Most have 18 as the cutoff. Some go to 21.
Do you think that when our kids play sports, is it still something that our pediatrician can help with, or should they transition into seeing a different type of specialty?
No, we see sports physical all day, and actually I get the knock on the door because I'm taking too long because when they're talking about baseball or their football, and they go, "You got 3 waiting."
So it's good to have a pediatrician that likes sports too.
Yeah, I can definitely relate to them on a different level for sure. All right, so parents, get out your notes. We're going to do some more rapid fire questions that parents want to know. So first one is, what temperature is actually concerning and when should we treat a temperature for a child? So I always freak out, oh my gosh, it's 100 or 99.1. Do they have a temperature? So when do I need to bring my little guy to the doctor or be actually concerned about it?
So I always say if you're getting over 100, it's get concerning, but you'll get many come in. I'm like, kid has a fever. How high was it? 99. And it's like, You don't want to make mom feel bad or something, but usually that's a low grade and kind of watch. And then for your question, it's really age related. A 3-month-old, 103, that's probably urine cath and blood work. They're too little and too small. And if it's something bacterial, spread quick versus a 12-year-old, 103, sore throat, can't swallow. Is it just strep? But anything over 100 start getting concerned.
Okay,
but
so
it's definitely that babies, those first 6 months, watch closely.
watch the temps. Okay.
And not only that, you'll get what kind of thermometer you're using under the arm and the forehead and the ear thermometer and kind of what nobody wants to do, but the most accurate is a rectal. But, you know, I always say if you can afford it, get the ear.
What about the rolling? The rolling ones are good too?
You can afford it.
That's more effective than the tongue, than under the tongue or under the armpit?
Number one would be rectal.
So new parents on their registry, we need to have a thermometer on there.
Yes.
So they get a thermometer.
Yes.
Thermometer and a nose Frida.
Oh, and
I love
saline
those.
drops.
And what?
Saline drops.
Saline drops. Oh, okay. The nose Frida scares me.
It looks kind of crazy. It looks kind of crazy. But
it works.
So,
and a coolness humidifier.
A humidifier, okay.
Yeah, humidifiers.
So new parents, put those on your registries so you can get those from your baby shower. Okay, so when do kids, if they're sick, right, when do they actually need to come in to maybe get antibiotics? Or can we fight it at home with medicine, over-the-counter medicine?
Depends on what's going on. Again, as we just talked about, if your kid's having a high fever and they're lethargic, won't drink, etc., bring them in. Some bring them in. If they're, like I mentioned, they have 99 temperature, they're in. So some will bring for the littlest things, some wait it out, but depends.
It really just depends on what the severity is of the case. Okay, good to know.
Another question. What's the biggest mistake you feel that parents do when it comes to sleep or a sleep schedule?
That's a big topic. When you're born, they're always told to sleep on the back, not face down. And I tell them that they'll roll and sleep how they want when they reach that stage, somewhere between 4 to 6 months. Why is that concerning? The sudden infant death syndrome, they found out from smaller countries that if you sleep on your back, it's better than sleeping face down. So then you can ask, when should a kid sleep through the night? Hopefully you're born with a kid and the kid sleeps from birth, but that doesn't always happen. If you're breastfeeding up to 1 or further, you're going to get up and breastfeed. Sleep becomes an issue. A lot of times you'll talk to the parents and they'll tell you their kid sleeps in the same room with them. I tell them that's going to be a hard one to break when you try to transition them at 1 and 2 to their own room.
I think we're going through that right now.
You know that?
That's a big problem.
Yeah.
Then never had a case have your baby sleeping with you, because there's one that passed away and probably the mom rolled over and the baby suffocated. So never have them sleeping with you.
What about like the sleep schedule? Like, I know with one of my kids, I was kind of concerned because I'd be like, wake up the kid every 2 hours to feed him. But my kid wouldn't wake up. He'd just sleep all night. Like, is that okay? Or should we be waking him up?
If you fed well during the day, like 7 a.m. to 8 p.m. or something. And like if you're bottle fed, you can quantitate, how much you're giving. And if you got in 24 to 36 ounces, you're good. Let the baby sleep through the night. Breastfed again, they're gonna feed on demand and may wake you up in the night. But as they get older, they'll fill up more, and then you start solids at 6 months. Then as they progress, they hopefully will sleep longer.
And what about like the older kids, like 6, 7, 8, 9?
They should be getting 8 to 10 hours of sleep a night. Should be.
I don't know. This digital world is.
Yeah. Some cut off the TV, no TV in the room.
Should we be worried if our kids are picky eaters?
Oh, depends. A lot of kids are picky eaters. So you'll get some parents come in and then they say that the kid's a picky eater and you show them the growth chart, your kid's at the 98th percentile. And I always say they're eating something because they're big. Then that kind of puts them at ease. Some are really picky eaters. They're just very picky, and it goes back to that growth chart is very important. And you show the parent, well, your kid is on the growth chart, but yeah, they are on the skinnier side. So you might want to throw in a multivitamin, then you give them a little handout of what for the age and what different food groups you should be getting in every day. And you tell them if they're little kids, you might even try to play games to get them to eat, make the carrot the nose and some peas the eyes. And, oh, mommy ate the nose, you eat a piece of the nose, and try to make it a fun or game. And they say they won't eat the vegetables, maybe make a burrito and toss the vegetables in, and they don't even know they're eating it. Then they say they're picky eaters, and then you'll ask, do they eat McDonald's? Yes. Do they eat candy? Yes. And it's like, well, I think your kid eats, just doesn't want to eat what you're cooking. So I try to nicely say you're in control, not the kid, and but then there's certain developmental issues, like an autistic kid is often a picky eater, and you tell the parent that's the way it's going to be. And they're only going to eat these 50, 20 items, and they will eat chicken nugget, but it has to be McDonald's. They won't eat ones from the grocery store, and you'll get those stories. And so they have a battle on their hands.
You just kind of have to push through it. And as long as the child is eating, right? Something.
Eating, go over the growth chart with the parent.
We're okay.
We're okay.
Okay.
Well-balanced meals.
Yeah. I know some people try to do like fruit, like a fruit smoothie, and then they'll put some spinach in there because you really can't taste spinach and fruit. Like, is that something that we could do too?
It's like if you got that kid and it's push or shove, whatever it takes.
To get some veggies.
But then you'll have the opposite, like the kid, like I said, maybe be 50th percentile in weight, and the kid, they say the kid doesn't eat. No, I'm giving Pediatrician. It's like, no, I don't think your kid needs. You're just putting on more calories. Your kid's okay.
Okay.
So it goes back to that growth chart. As long as they're growing, we should be.
I know they're important, but I didn't know why they were so important. So it's good to know. You really look at that. Okay, so regarding behavioral and developmental, what is something parents call out or worry about that's actually normal? So, like, I'll give you an example. And you're my son's doctor. So I remember coming in when he was, I don't know, maybe almost 2, I guess, let's say. And he wasn't talking. And I was concerned, and I, was like, okay, maybe there's more to it. Why isn't he not talking? So that's my example. But is that one of them? Are there other things that people or parents are concerned about when they don't know, right? And so they're going to come ask you those questions about their developmental states. And
so whenever they come in and it's well checked, but they may bring it up on a sick visit, I call it, like, I give them a safety speech, a developmental speech. So at 18 months, kid should walk, run, climb, get in trouble, scribble, take some clothes off, 4 to 10 words. And then you'll tell the parents, your kid have 4 words, and the mom will say, no, he only says mama, dada. Then the dad say, no, he says hi, bye. He says the dog's name. Then I go, all right, we're already up to 5.
Okay.
But then you'll have the 18 months that's, almost putting words together. So it's so variant. And you try to, when you get closer to 2, that's kind of, Then they say I want speech therapy. Then it's I always say it's like a light switch. You turn on the light switch, and they'll come back, oh, he's talking now.
That's what happened to me.
Same thing, they'll bring up walking. My kid doesn't walk yet. And I go, does the kid walk along? Oh, yeah, he walks along the furniture. He just doesn't let go. Then I go, well, your kid walks, so it's going to happen. He proves he can walk. So then I kind of tell him, enjoy, because once he or she lets go and walk, the fun begins.
Yeah. Now he talks like crazy. He won't be quiet. So he's good. He talks. So we just have to be a little patient, I guess. Then, huh? We get so.
Another one is kind of go together: bedwetting, toilet training. So I say the average is in their 3s, but some come in and at 2, I can't toilet train my kid. I go, if your kid throws a tantrum or have a fit and doesn't want to do it, I tell them you're wasting your time. It'll happen when they're ready, and the first time, sometimes they'll come up, poo-poo, poo-poo, and they went, and they know they're supposed to tell you, but they already went. So next day, if they tapped on me at 5 o'clock, I'm putting them on the potty at 4 o'clock. And if they go, they hit the winning home run in the World Series. Oh, hey, your baby, oh, you did it.
Make it a big deal.
Then that transitions to the kid wets the bed at 4 or 5, and you tell them, they're not doing it on purpose. It's just, it's so don't yell at them or scold them or anything. It's just you tell them to go through everything. Same thing with ADHD. You try behavioral modification. So with the bedwetting, cut off fluid, 637. You try to wake them up in the middle of the night. No caffeine during the day. Often the bedwetters have small capacity bladders, so you try to get them to drink, so that bladder gets used to being full. Then if they reach that stage, 5, 6, he's in the Boy Scouts and he's scared to go, then you start talking medications, or is it something physical? Check the urine or renal ultrasound. Do they end up having to see the urologist? But I always we just start with behavioral, and I'm here. It's not like, see you later, I'm not going to talk to you. You got to come back.
Come back, yeah.
And continue the journey.
Yeah, okay. Okay, so a burning question that we feel like a lot of parents don't ask or are embarrassed to revolves around the screen, the phone, the tablet. So whether that's a tablet, a phone, the TV, how much, in your opinion, do you think is too much, or is some healthy? What's your opinion on the digital world we live in today?
Under 2 is supposed to be none of that, so they can do all their, meet their developmental milestones. But as you just said, we live in a digital age and single parent and multiple siblings. So they may have to put that 18-month-old on the couch because I got to cook dinner and tell the 6-year-old, watch him, and they're over there watching Toy Story or Incredibles or something, or Netflix. And
Right.
the little kid comes in and tells me about Batman.
The Simpsons.
So then over 2, and when you go all the way up to teenagers, you only a couple hours a day. And I always say when I get the school-age kids or the teenagers, like in the summer now, okay, it's summer and your parents may let you watch TV, but once school hits, you got to do your homework, get good grades, and then that TV is like a privilege, or that video game is a privilege, but you can't, come home with C's and D's and you're on the video game all day and watching TV. Then you'll be actually in the room with some teenagers, and you say, okay, I'm going to give you a quick little safety speech and, all that. But they're out with their phones and they're looking at their phones. So I just go and gently take their phone from them. And then the mom will say, give me that phone, boy.
Oh, to you or their kid?
No, to the kid.
Okay.
Get off your phone.
Yeah.
But then also you'll do an exam on the 2-year-old and they're crying, and one of the parents will break out the phone and pet it while you're examining them to kind of calm them down. So sometimes it's helpful.
Okay. So if they were to watch something, is there besides, we all love Disney, but a favorite, what is Little Einstein? Yeah, okay.
It's great.
Sesame Street. Little Einsteins, I think, is a good one.
Didn't they cut the, what channel was it on? What is it
PBS.
called? Yeah, didn't they cut that though? I don't know.
I don't know.
I think you can find.
But we could still find Elmo, right?
I think it was going to move to Netflix or something.
Oh,
okay.
They were going to keep it rolling. So.
All right, so we want to watch Sesame Street. I feel like there's
more
others.
Learning
we are learning.
Than not the Apple pads, but there's a lot of pads for little kids where they come into the office with it and they're teaching. I go, whoa, that's pretty cool. And I start playing it instead of doing the exam. It teaches you how to count and numbers.
Okay.
And I was like, wow, that's
So
pretty
definitely
cool.
more like interactive, like when they're being
Yes.
asked, like ABC question or 1, 2, what's 1 + 1, those kinds of things. Okay. So screen time's okay in small amounts.
Small amounts.
And
like
definitely
2
try
hours
to
a
do
day.
2 hours a day, and definitely try to do more interactive with them at their age groups, right?
Because
Okay.
you want them to do other things. Like I said, do your homework, socialize, hopefully play a sport. Or some sports, I always say, is so great because you're in a team and it teaches you discipline. You got to, how do you handle say you're the average player? How do you handle the superstar? How do you handle the kid that doesn't want to be there and is hyperactive and just causing chaos?
Yeah.
And then there's everybody else. And that's a good area. If you have a great coach, it's where you learn how to interact with other kids.
I never thought of it like
sports
that.
is so good.
Yeah. I always thought it more on the active side. I didn't even think about it like the behavioral, situational. And so, okay.
Another segue is like COVID really ruined it.
Yeah.
Because these kids used to play everything. Then right after COVID, they came in, nope, they weren't playing any. It's back now, but they weren't playing anything.
Yeah.
Another segue, you'll think about COVID and all the deaths, but it ruined a lot of teenagers. They used to be like A students, now they're F students, and now they're anxiety and depression. They'd rather be homeschooled. So
That
So
disconnection.
you've seen an increase in that since COVID,
yes.
you think?
Oh, yes.
Because what our COVID babies, right? Well, some like mine's a COVID baby. He just finished kindergarten, but like our teenagers are now
The teenage ones.
teenagers. Okay, and so they're having to deal with the mental side of it. Wow.
And
I
that's
didn't
a
think about that.
whole
I didn't either.
another
Yeah.
discussion of mental health is so hard to get help.
Yeah.
There's not a lot out there, and you don't want to have to drive down the hill. And
Right.
It's probably harder for our kids too, like for our younger, the younger kids. I mean,
you
it's
think-
hard for an adult
Yeah.
to get mental help,
I think so
I'm
too.
sure
I mean,
that's
there's avenues, but sometimes it takes a little process to get that. But okay. Do you have one more for him? I think you do.
Let's see. Okay, so this is probably not something that we always talk about.
Yeah.
But I know you're my kid's doctor too, and you say it at our visits. When mom's in the kitchen and we're cooking, kids are in the living room, and they ring the doorbell. Someone rings the doorbell. And a lot of people don't talk about. Honestly, I didn't talk about it with my kids.
either.
I have a 9-year-old, 7-year-old, 3-year-old. I didn't sit with them, or 4-year-old. I didn't sit with them and actually talk about it with them. Had our yearly with you, and you're talking to my kids about when someone rings the doorbell. So I think that's important. Something like, what are your thoughts, or how can we educate our kids on when someone knocks on the door or rings the doorbell, or what should we tell or those listening, like what should we tell our children when they ring the doorbell? What do we do?
so I always say, if say the medical assistant's 2 kids or 3 kids, and she's not ready, I said, I'm going to go in and give them the speech. So everybody knows I give this speech.
Speech.
And
Good information.
part of it is, and a lot of it's safety. So if you get the littler kids, you say, so they're walking now, you have the chain bolt or something so they can't get out the door. And then I tell them when they hit about 3, 4, you got to start disciplining. When then somebody rings the doorbell or knocks on the door, every time you go to that door, turn to that child and say, don't you ever go to that door, you come get me. So hopefully 2 years later, they're 5, you done said it 2,000 times, somebody knocks on the door, Mom, door. But I'm telling them still till they have it down, have that chain bolt up there. Then you get, like I just had 2 teenagers this morning, and I said, somebody knocks on the door or rings the doorbell, what did Mom teach you to do? And sometimes I'll go, don't open it, okay? Then I'll knock on the table or something. Don't open it. I'll knock, don't open it. Knock, don't open. I go, okay, we got it. You're not gonna open the door. What are you gonna do? Go hide in the room. I go, no, this isn't the Scream movie or anything. No, it could be a package for Dad. Leave it at the door then. I go, no. But then maybe
They know you're in there.
Then the mother finally says, you come get me. I taught you this. Come get me. Then another If you get the girls and say like they're 14 or 15, they're only there with mom, I'll say, Mom, I'm not going to let you open the door till you're 18. Your dad's not going to let you open it till you're 30. And I say,
True.
tell him I said that and he'll like me.
Yeah.
You. I think you told my niece, you gave her a Costco story because she loves to go get food samples. So now she knows not to go without mom to get her food samples at Costco.
Another safety right there.
Yeah. What you named that? What is it called? The situational? Am I saying it right? You gave me a name, and now I forget the name. It was like a term that you used for having those conversations. Besides the speech,
development and safety.
Safety.
It's a
Safety.
anticipatory guidance.
there we go. I knew there was like a big fancy word for that. And you think that we should just start that from the get go, right? Because then it just becomes engraved in them.
So if you get the new one, I say to them, like you get the newborn, every time you see me, you're going to get development, what's happening today, what's going to happen your next visit. We're going to go over safety every time. We're going to give you a growth chart, show you how your kid's growing. Any questions, look you over, get you out of here.
Yep.
All right.
That's how it rolls.
We like that. All right. So our last question for you, and we ask this to all of our guests. If our listeners could take away one thing, like the most important from today's conversation, what would that be?
Well,
Like there's too many.
It's
Too much. Too much.
kind of the big picture, what they do is love your kids. I would tell you, you may not think now, but it is going to fly by.
Yeah.
Your kid's going to be 20-something so quick. And because I'll be in the room and see that, wow, you're 4-year-old already? So, I mean, time will fly.
Yeah.
And just as you kind of heard us talking, you should keep those visits 2 months, 4 months, 6 months, 9 months,
Right,
1 year,
right.
15 months, 18, 2 years. It's even if you don't vaccinate, there's more to talk about, the safety, and then another thing that I tell the parent, I had one last week. She hit her head on the coffee table a couple of weeks ago, and you try to tell them that stuff's going to happen. You can't prevent everything. They're gonna, but you try to prevent the big ones in that safety speak. Don't go in the street, get hit by a car. Don't go in the pool to drown. Don't pull the pot off the stove to get burned. Don't the floor, no medicines on the ground for the kids to choke on. So I would say, make those visits so you can keep drilling into their heads.
Prevention.
And I feel like there's not always a dumb question, or there's not always a dumb visit. Like sometimes some people are like, why do I need to take him to the doctors for that? And it's like, sometimes it's like a peace of mind. Like, you can have something so little and you really don't know what it is. So it's not always like, just take them for the visit. It's not always,
taking a peace of mind. Sometimes you tell them, like, they'll come in for this, let's watch it. And you tell them, I'm not going nowhere. So if it worsens, come back.
Yeah.
And so you tell them, like, kid's not talking yet. Okay, we're going to see you back at 2. Let's see how my kid's not walking. We're going to see you back at 18 months. So we're not dropping the ball.
No.
Come back.
I feel like as a pediatrician too, you're not actually just the kid's doctor. You're the
parent.
You're the parent doctor too,
Educator.
because as a first-time mom, you gave me a lot of reassurance that I was doing things correctly, or my way was a good way, So I think as my child's doctor too, like, you help us as parents know that we're doing the best we can, and you reinsure us with that. And so we thank you for that. But yeah, I think a pediatrician just isn't for kids. It's also for mom and dad to help out with that.
I try to make it light, lively, but you got to gauge the audience.
Yeah.
Do they want the humor? No, they just want to see my kid get out of here. But
You're pretty funny at times, so.
at times,
Just sometimes.
all the time.
I can't. Okay, I was trying,
They look.
You're right.
They look. Was he serious about the sharks?
No.
Because he did it with a straight face.
Wait, what?
Was he-
No.
And I
We
used to
enjoy that.
have the most decorated rooms ever.
I know,
But
we're working on that. We're working on that. We're gonna get some good paintings up there, so don't worry. And we need to get you 3rd year in the row best pediatrician of the high desert. So I think it's just deserved.
Nominations
and
are here,
nominations are here.
like Kobe and Shaq, 3-peat.
Let's do it. Let's do a 3-peat.
3-peat.
That's our campaign. So yeah.
Yeah.
All right, Dr. Barber. Well, thank you so much for joining us today and sharing your expertise with us. We hope today's conversation helps some of our parent listeners, maybe our grandparents even, who, take care of their grandbabies. And then we hope we answered some of your common questions and concerns.
And thank you to all our listeners for tuning into another episode of Beyond the Chart. We hope you enjoyed today's conversation and learned something new. Be sure to follow us on all social media.
All social media.
Facebook,
Yes.
Instagram, TikTok, subscribe to our YouTube. And if you want to watch any future episodes, they are all going to be posted on YouTube as well.
Yes. Oh, we got
We're
one more.
all very sad that Mexico and the United States lost in the World Cup.
Yep, we are.
But
We are.
maybe the women's will win it.
Let's go.
Let's go.
Let's go. Awesome. All right. Well, that is it for today's episode. Until next time, I am Candace.
And I'm Teresa.
And thank you again for listening to Beyond the Chart.